Hello, everyone. I hope you guys are having a great day, night, evening, wherever you guys are tuning in from. Welcome to our live session today. I will be going over a quick startup presentation to welcome you all and introduce you to our program and opportunities if you have, of course, not attended one of our previous live sessions. So I do want to highlight that Pre-Health Shattering is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Jesus. I am the Chief of Program Planning at Pre-Health Shattering, and I want to thank you all for attending today. Okay, so let's get started. Okay, oops, there we go. Just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your screen. And if you need assistance enabling the transcript, please direct message one of our team members, the ones with the blue background. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So please, please do. If you have any recommendations for how we can improve, you can email us at info@prehealthshattering.com. Okay, so since this is an international program, we want to know, where are you guys zooming from today? You can drop it in the chat so we get a little of an idea from where you guys are zooming in. I myself am zooming in from the Caribbean, the beautiful island of Puerto Rico. Okay, great. Thank you guys so much. Okay, yes. Wonderful. Okay, so since this is an international program, we want to know, where are you swimming from today? Oh, I'm sorry. If you want to stay in the, oh, I believe my internet connection has, oh my God. Oh, oh no.
Repair or replacement, but then the person doesn't just automatically regain all of their function. In this case, he had some rotator cuff tears for sure on the right as well. That those are the main stabilizing muscles of the shoulder. And when he tries to work against gravity, which we have to function against in most of our daily lives, he's not able to get a normal motion. And this is pretty dramatic loss of function. This individual also had some pretty substantial depression going on. He wasn't able to work. He wasn't really able to take care of himself very well. And so, again, the profession is very rewarding in that we were able to work with him. We got him out of the anti-gravity position. So take away the biggest force we work against in our daily lives is gravity, put him on his back and start working on his range of motion where he doesn't have to accomplish everything against gravity. And that gets rid of a lot of what you're seeing here is substitution. So if you know a little of your anatomy, you see he's shrugging his shoulders to try to get as much motion as he can. But in this particular case, it actually works against him because he's not getting normal shoulder blade movement that can still control the shoulder. So really, really interesting case, and one where he made a lot of progress after this. The similarity to the person on the right is that shrugging motion. So again, you see this individual also shrug his shoulder here to get as much motion as he can. But the difference is now here's his shoulder blade. He's really using his shoulder blade and maximizing the motion that he can get, despite the fact that he's got what's called adhesive capsulitis, where the capsule around the shoulder joint is actually adhered and limiting how much he can move the humeral head versus the scapula. The other interesting thing here, just in quickly looking for a quick anatomy lesson, this individual is real thin. You can actually literally see the fibers of his lower trapezius here and middle trapezius muscle. And so in this case, it's really easy to tell that he doesn't have a dysfunction in that muscle. He's doing everything he can with that muscle. And again, we need to break down and figure out which muscles are working, which muscles aren't working. Are there tissues that are restricting normal motion? Are there other pathologies that are going on, like arthritis of a joint or things like that? And then ultimately developing a treatment plan for how we're going to help these individuals improve. And the person on the right needs much more stretching and mobilization of the joint to get rid of the tightness, whereas the person on the left needs much more control of the motion and building up the strength of the remaining muscles that he has. So just sort of a little bit of a taste of what we might see in a typical patient case situation. Both cases here needed to reduce that upper trap activity because it's really a compensation that gains very little positive motion. And we know that because we have a good understanding of the basic normal mechanics that should happen. Both of those cases, the humeral head is sliding superiorly, and that's actually creating more problems than benefit. But again, one case had a lot of soft tissue stiffness and another had a pretty substantial stability deficit. So again, in terms of what sort of a day in the life of physical therapy is, there's a lot of different patients that we work with, but that unifying theme is trying to help them improve their movement. In this case, this is someone who's got some support from this device here that's probably unloading part of their weight to allow them to function perhaps post-stroke or some other neurologic disorder. So really, again, fundamentally what physical therapists do, our expertise is with regard to movement. We try diagnose and treat movement types of problems. In terms of the work environment, that includes individuals from neonatal intensive care units to full geriatric across the entire lifespan. And a wide variety of health-related conditions from neurologic problems to orthopedic problems, cardiovascular problems, integument problems where there's wounds or other problems with the skin, and then a variety of settings from private practices to hospitals, to nursing home settings, again, schools because of the pediatric population. So it's a really broad profession. When I was trying to decide what I wanted to do, one of the things I remember telling people was it allowed me to make a decision about my career without making a decision about my career, because ultimately there were still so many avenues within the profession that I could take that allowed me to get to understand the profession better before I narrowed in on my particular area now with regard to shoulder rehabilitation. So again, we diagnose and manage conditions that limit movement, and it's really a lot related to people's ability to function in their daily life, trying to enhance their health and wellness, their fitness, the quality of life, and get rid of impairments and limitations. And so I am going to go ahead and show here, this video is basically a YouTube video that the profession has generated, but it's a really nice overview, I think, of the wide variety of things that people do here. So and we're stuck with an advertisement here first, so apologies for that. I'll try to get past that as soon as we can.
That look is a look that can only happen by a roaring fire at a verbal cabin. After eating rainbow.
Ludewig, I'm sorry to interrupt you. We're not able to see the video. You're still presenting your slides.
I learn, I treat, I
so let me stop this and start it over here. So I'm going to try just resharing now directly to the video. Hopefully that will solve it. Can you see that now? You see an individual here?
Yes, we can.
I'm going to get rid of that. Try to get it going again here. It's just out of my view. Hang on one second.
Communicate.
Motivate. Every experience is different.
There's no cookie cutter approach.
And it's rewarding.
I strengthen.
Enable.
I treat.
We heal. You're helping those who can't do.
Caring.
Educating.
Encouraging.
Just helping people.
Funulating.
You need to go in with a completely open mind because something very cool might come out.
physical therapist here at the National Rehab Hospital in Washington, D.C. This is the cardiac rehab. So we're working with patients with heart conditions. You get to use your thinking skills, analytical skills, problem solving. I mean, her BP 135 over 95. And you get to do so much. It's really awesome.
Right now we're in Independence Square. It gives the patients an opportunity to practice the things that they've been working on in a real world setting. So this is a kitchen that we're in right now, and it's set up just like any other kitchen. The sink works, it's got knives, it's got plates, it's got food, and you get to practice. The best thing about being a physical therapist is getting to see your patients improve. When you get to see them go home on that last day and they're walking out when they came in a wheelchair or they came on a stretcher, and you get to see them leave walking.
You want to walk down, touch the wall, come back to the exact same spot. I'm a board certified neurospecialist in physical therapy. I see everything from spinal cord to people who are dizzy, stroke. I mean, people come back from Iraq. I mean, you name it, we see it. We're looking to see what we can do to maximize his overall function. It's never boring. It's always different, and you can actually try to pull in your clinical reasoning skills, the best evidence that's out there, what the patient values, put it all together and see whether or not you can really make a difference.
I see mainly geriatric patients in outpatient therapy. So I treat a lot of the cancer, rehab, and the lymphedema population. I think the best thing about being a physical therapist is that you are a motivator and a coach. It's not meant to be deep because the lymphatic system is directly underneath the skin.
I am a student physical therapist. Here, in a neuro setting, certainly you put your hands on, so you teach the patients what to do. But there comes a time where, it is just mental. So you put your hands on the patient, it's now time for them to do as much as they can.
I'm Tim Dockin, physical therapist with Fairfax County Public Schools. Will has cerebral palsy. Good. Press it down. Yeah. More than just being a physical therapist, I think. We're an advocate. And so we see so many aspects of these kids' lives and that we can help them out.
You're touching the side. Don't try not to touch the blue. Our whole goal here in the middle school is to prepare them for high school. We make most everything into a game. All right, there you go. Oh, nice one. So the more fun we can make something, the more willing they are to do it. Okay, good job. Andy had meningitis when he was a kid and had some brain damage because of that. Push up. Good. Stand up there. No, don't you sit down. When I had decided to change careers and go back to school, I went and worked in an outpatient clinic, and I saw how they were getting people better. The people I worked with were great, and the difference you made in these people's lives were great. This is Andrew, and he's 12 years old. He has cerebral palsy, so he has trouble controlling his movements. And both together, okay, Andrew, stop. Okay. Stop. We want to get them to do as much as they can themselves. That's perfect. Okay, we're doing donuts. That's not supposed to happen until you're 16. It's just fun because you've made a difference.
I'm Denise Constanti, and I'm a physical therapist with the Jackson Clinics. You definitely need to have your hands on the patient and feel how the muscles are working and seeing if they're flexible. You have to have all three things coming together: flexibility, strength, coordination. I've actually come from this from the inside out. I was an amputee at a very young age. I had a prosthetic all my life. you learn to overcome, and I wanted to teach others how to do that for themselves too.
And what we call the ligaments, the things that keep the leg together. I'm a physical therapist assistant. All right, so now we're working your knees. If you want to be a physical therapist, you want to have a passion for the human body, because that's what you do. The human body is your business. Stabilize.
I used to have a problem with walking on the outside of my toes.
So what we wanted to do is teach Nikki to land more with her feet straight, and notice that when her foot is like this, she has got a normal arch. With every physical therapist who works with any athlete, you want to see your, and I want to see Nikki, and I want to see her go out there.
We're in the MAC team. It stands for the Military Advanced Training Center.
Fun, and I can't. I've learned how to do everything again. You know, my legs were taken away from me. Now I need to learn how to live all over again.
When you are missing your knees, like Brian is, and you get mechanical knees or computerized knees, you have to relearn how to walk in a different way than you did before.
I'm the research physical therapist at Walter Reed, and I do a little bit of clinical work through my day, but as a research physical therapist, I'm also doing research through military grants. Andrew's actually just learning on the power knee.
I can see the potential it has, but right now it's just trying to get used to when it's going to move and how it's going to move. It's just real difficult.
So all of my day is spent doing amputee research and treating amputees. And then some of our research is early rehab, some of it's late rehab, some of it's to do once you go home. We try to hit all aspects of care. That red line that's coming up when he's walking over this gray area, for the joints that you do have left, your hips and you're on this side, your knee and your hip, you want to kind of minimize those forces, or at least make them as normal as the knee would expect. These guys are great to work with. They're unbelievable. It's orthopedics to the extreme, because you're doing sports med, orthopedic rehab, but with a patient population that wants to do that and they don't have legs and they don't have arms, and you have to figure out how they're going to do it, how they're going to run and jump and ski.
I would like to be able to run my 2 miles in 13 and a half minutes.
This will be him in about 9 months to a year.
It's fun, it's creative, and they make it an extreme talent every day.
Problem solving. I mean, her BP 130.
So I'm going to get back to the other slides here. So hopefully that gives you a good idea of, again, it's just a really broad profession. And a couple other things I think that came out there that certainly resonate with me, and the time I've been a physical therapist, it's extremely rewarding, because again, you're working with people who are essentially only going to get better, whether it be overcoming pain and getting back to their function, or some major debilitating illness or experience that they've had that's really limited what they can do. So that rewarding goes along with high job satisfaction. Then ultimately, PT is quite often rated in one of the top best jobs kind of categories related to job satisfaction, in terms of just people really enjoying their careers. Again, just a number of different areas where it's been highly rated as far as best jobs in terms of what people can choose. There's also predictions of pretty substantial job growth. So up to COVID, there was pretty much a guarantee that you're going to get out of school and you're going to have lots of job opportunities. Obviously, COVID impacted everything, including aspects of healthcare that weren't emergent for everybody. And so there were some slowdowns and things, but it's coming back quite strongly again. And also COVID itself is one of the areas where physical therapists, people who experience long COVID, need a lot of rehabilitation. And they come out of, rehab units and things like that. And physical therapists are highly involved in their care from the ICU to their later times. So it's growing in terms of the profession as well. One of the areas here then that always people are interested in is what kind of income are they going to make with this profession. And it's certainly not the same as a physician is going to make, but these are substantive incomes that people are going to have. And it varies a little bit by the type of setting, mostly related to where there are bigger shortages in terms of different areas of provision. So skilled nursing is typically some of the higher salaries, and then the private outpatient, sports medicine or some of those types of things that are a little more popular tend to have a little bit lower salaries. So in terms of becoming a physical therapist, then in the US now, you have to have a what's called a doctorate of physical therapy. It's not a PhD, it's a clinical doctorate. So it's more similar to an MD or other professional doctorates. And then you have to pass a state licensure exam. Again, there's a whole bunch of specialty areas. And so you can get your basic physical therapy degree and you can practice as a generalist across all this breadth of areas, or you can decide to specialize and pursue additional specialization certifications in any of these areas. So again, just a wide range of things. And there's two paths basically to specializing after school. You can do a residency, which is sort of again, follows the medical model. They're shorter for physical therapists. You spend about a year to 18 months in a residency. And then there are fellowships that you can do that get even more narrowly focused, which again are typically a year to 18 months after your schooling. For University of Minnesota, this is basically our basic goal to ultimately prepare students for clinical practice, but also to be professionals and to have some capability to interpret research literature, and if they so desire, to get involved in research aspects of physical therapy as well. If you wanted to be a full-time academic researcher, you would actually get a PhD degree as opposed to the DPT degree, but we have a joint degree where you can consider both of those in combination as well. For our program, it's 3 years, including summers, 9 semesters in total, and that's fairly typical, although there are some new programs that are trying to shorten the time. My personal opinion is that it's not really the best way to go to try to shorten it as much as possible, but there are other models. And then there's a few 4-year programs where they actually stretch things out more, but most commonly it's a 3-year program after your bachelor's degree. This are, again, our specific requirements for the University of Minnesota, which you may or may not want to know all these details. I believe you have access to these slides. You certainly have access to the recording afterwards. So I'm not going to really spend any time on this unless people have specific questions about that. This is just some statistics relative to our most recent few years of classes in terms of applicants and class size and things like that. Overall, as you would make a decision about this, certainly encourage you to take a look at programs. There's just like there's a wide variety in the profession, there's a wide variety of educational models, and there's some that are fully case-based, some that are more traditional. Again, there are these shorter accelerated programs. So take a look at what the differences are, look at the prerequisites that are required. Typically there's some sort of observation experiences that are expected so that you have a good sense of the profession. Most programs are requiring the GRE, although that's starting to change a little bit. Definitely references from appropriate individuals. And many programs are rolling admissions. So the earlier you apply, the best chance that you have, although there are certainly other programs that have set deadlines as well. There's also a big difference in cost across programs. And so you're really wise to take a look at what the program offers, find out what's the best fit for you, but also consider those cost parameters. Obviously, state programs, public programs are going to be less expensive typically than private programs, and there's at least 50% of programs are in private schools. So again, there's a lot of benefits in terms of a physical therapy career. You can really make a difference. You can develop a very specific expertise, got pretty good job security, again, really high rates of satisfaction with the job. Because of the general need for physical therapists, you can choose your location. And more, there's a lot of entrepreneurial things people are doing. One of our current third-year students who's about to graduate has some paramedic background experience. And so he's going to actually develop programs in an emergency room setting where it can combine some of the skills he has as a paramedic with the skills he has as a physical therapist. And so there's just really unique opportunities for people that are more entrepreneurial in what they are thinking about doing as well. So again, if you're interested in how the human body moves and works, and you want to interact with patients in a very hands-on way, you get to mix the interpersonal skills of working with people with the science of understanding all the anatomy and physiology and how the biomechanics works. And so it's just, again, I think a really nice interaction of things, and you function as a coach and motivator as well. I'd like to show this slide too. So I'd like to say one of these pictures is real and one of them isn't. The one on the left is not real, but the one on the right is. So this is a woman that's a gymnast, well into her 90s. She's been in some limited competitions into her 90s. And those are some healthy shoulders that it takes to be able to do that into your 90s. And I think a big area that's growing also is learning how what's optimal movement and how do we help people maximize their function throughout their entire lifespan and really allow people to do some of the things that she's doing to figure out the secrets that essentially her body holds and she holds in being able to perform at that level well into your 90s. So a few other resources. There is an orientation to physical therapy course at the University of Minnesota. I'm sure there are others elsewhere. There's access to our website here and our admissions coordinator as well. Resources from the American Physical Therapy Association overall. PTCAS is a centralized application service that a lot of schools are involved with. And then there's our accrediting body information there as well. So I'll leave it at that and open things up for questions and comments here.
Thank you so much for your wonderful presentation. Some of our students have a couple of questions. So for Anthony, he asks, are there going to be summer internships pertaining to physical therapy? I understand the circumstances with COVID-19 make it difficult for in-person programs. However, it seems that the world is getting back to normal and everyone is getting vaccinated. So he's just curious if there are more in-person internships or job shadowing.
Yeah, so I believe so, yes, definitely. It's been a slow return, but most clinics are functioning now. Actually, that's an interesting side note. When things happened with COVID, quite a bit of physical therapy converted to telehealth, just like many other versions of telehealth. Physical therapy, I think a lot of people would have thought was so hands-on, how do you do it with telehealth? But there's so many aspects of it also that are educational and that you can see the person move through the video and things like that. So those opportunities actually open up in some cases. Clinics that are doing telehealth, it's actually easier to have students shadow because they can just go through the process of getting the appropriate software and the HIPAA privacy things. And then they don't have to physically be there and there's no risk of things. You can have more than one person in the background and all of that. So I would definitely take a look at whether there are programs. It also doesn't have to be in your local area, but where you can shadow through telehealth type experiences. Otherwise, most of the clinics in Minnesota anyway are back up probably to about 75% or so of their previous capacities, and they're definitely starting to take students again for shadowing experiences. The other thing that you can do with universities sometimes is get some exposure to physical therapy research. And I know for the University of Minnesota, there had been a lot of restrictions on that, but now that's opening up such that this, at this point, you would be able to participate in those.
Okay, thank you so much for answering our question, Doctor.
Yeah.
Okay, so another member of our audience, Bhakti, asks, what concerns are PTs more mindful of when working with patients in rural settings? Are there any cases you would see more often with patients in rural settings compared to other settings?
Yeah. So I worked the first 2 years after I graduated in Aberdeen, South Dakota, which is about 25 or 30,000 people in the city. And then it was a regional referral hospital for areas that are even more rural than that. And I loved that experience because when I first got out of school, I still didn't know exactly what I wanted to do. This is maybe a theme for me. I really wanted to, I liked pediatrics, but I didn't quite see myself doing that 100% of the time. And I also liked other aspects of care. So the really neat thing about a lot of the rural areas is you see that whole breadth. You might see a pediatric patient in the morning, some inpatients throughout your day, as well as outpatient orthopedic, which is still probably the biggest chunk of physical therapy care. So I could treat a stroke patient, a pediatric patient, an individual with an ACL ligament injury, someone who got a total knee replacement. All of those things could be within my day, and that variety and exposure I really loved. And then from there, I narrowed in and again became more specialized as I went on from there. Versus if I had taken a job in a major metropolitan area right away, most often you end up in a more narrower scope. So you're treating at least only neurologic patients or only pediatric patients or only geriatric patients. So I think that's one of the big advantages of the rural areas. And I saw some really unique things. So Guillain-Barré syndrome is a pretty rare condition. I saw a patient with that when I was working out in South Dakota. I also saw a patient with a finger replacement. That again was a very unusual and rare thing. I saw patients with dermatologic conditions. So again, because there's not all the different specialists in those settings, you get to see that wide variety. So I think it's a really, really neat opportunity to practice in rural settings.
Yeah, that's fascinating. We've had professionals talk about wilderness medicine and all the different pathologies they see from like rural areas and just in the wilderness.
Yeah.
So Bhakti is asking, could you talk a little bit more about your journey into PT? What motivated you to become a PT? Because you've talked about how you were you were unsure as a student of what you were going to do.
Yeah.
So what really made you go into PT? There are so many rehabilitation professions like occupational therapy and speech language pathologists. So why PT?
Yeah. So yeah, when I was in high school and trying to start to figure out what I wanted to do, and back when I was educated, basically a bachelor's degree is what you got to become a physical therapist. So there wasn't getting your bachelor's first and then going on. And so I was trying to figure out what I wanted to do, and I wasn't all that sure. I was interested in health. I knew that. I thought about becoming a physician. The reason I decided not to go that route is because of I'm a very reflective person. I like to think about things. And that's, I'm sure, why I've ended up in academics now, where research is a big part of what I do. But the thought of being in an emergency room and having to make a life and death split-second decision for a patient really was what caused me to say that that's not the right fit for me. So then I said, I don't think that's the right profession for me to consider. So by the time I left high school and went on to college, I chose a college that had physical therapy. My mom was a nurse. And so she was the one who first pointed out to me, I didn't even know the profession existed. And she's like, I think you might be interested with your interests in health and working with people and those sorts of things. And so she pointed out the profession, but I still wasn't sure. And so I was deciding between clinical lab science and physical therapy. And the school I went to, which is a small school in northern Minnesota, had both of those degrees. And so I went off to college to try to narrow it down between those two. And then it really came down to the interactions with people. Again, you get a lot of that interaction with people. And I was a pretty shy, quiet high school student. So at first, a lot of interpersonal interactions didn't seem logical, but once I realized that's very one-to-one kind of relationship that you have, it's much less intimidating that way. And so it was just, for me, it was the right fit that I like the science, but I like working with people with that science too. And so it was just sort of finding all those pieces. And then I practiced as a clinician for about 5 years in some more regional referral center areas in Aberdeen, South Dakota, and Mason City, Iowa. And neither of them are huge cities, but had a really nice variety of things that I saw. And then I realized I loved what I was doing in the clinic. And I thought I was going back to school to just be able to do some teaching, and that I would probably come back to the clinic. And once I got to school again and got introduced to research, I was just really fascinated by that. And so that caused me to continue on for my PhD and end up in the setting that I am now. But I still see some patients in the clinic. And that still is just a really cool mix for me, because I do my research in shoulder biomechanics and rehabilitation. I teach in that area, and I see patients in that area. So it just brings all those aspects together in a really fun and exciting way for me. So.
Okay, I believe that's wonderful. So we were wondering, okay, so you decided that you wanted to be a physical therapist, right? But was there anything you didn't expect going into physical therapy?
Yeah, I think the breadth, again, I didn't even know before my mom told me about the profession. I guess you asked me to touch on a little bit of the differences between the professions. So I have a sister who's a speech therapist. So I can speak to that a little bit as well. Probably some of the biggest differences are the speech therapists are not so hands-on, because it's truly physical therapy. You're stretching people, you're helping strengthen people, you're doing manual techniques with them. And you're very much a coach in many ways too. With the speech therapy, they're working with things from swallowing disorders to speech dysfunction and things like that, but it's not physical hands-on. So that's a little bit different. So a lot of the similar populations, a lot of, again, figuring out what's going wrong for a person and treating them, but there's a difference in the hands-on versus non-hands-on, I guess, of those two professions. Occupational and physical therapy are very similar. There's a lot of overlap. In some places, occupational therapy does upper extremity work and physical therapy does lower extremity work. That's not a good dichotomy, in my opinion. I think the originally intended distinction and more of that distinction is that the occupational therapist is very focused on getting the person back to the environment, and the physical therapist has to sometimes work with things that are necessary before you can get them back to the environment. So again, basic motion, strength, things like that. Often the physical therapist spends more time with the biomechanics of it, and the occupational therapist might be more functional oriented. There's also aspects of both speech and occupational therapy that relate to cognitive training. So if someone has a head injury, for instance, and a concussion, maybe that's pretty severe, and they're having physical deficits after it, balance, loss of strength, physical therapists will work on those things. The occupational therapist or the speech therapist might work with them on their processing parts of things. How do they figure out problem solving and some of those things, again, that are not so hands-on and physical in nature, but are obviously important to the overall capabilities of the individual. So there is a lot of overlap between OT and PT. I'm obviously a PT, so I'm biased towards that. but you know, particularly for upper extremity problems, they can look very similar. But an occupational therapist would tell you that physical disability is just one aspect of what they work with, where it's the largest part of what we do as physical therapists.
Thank you for that dichotomy and just elaborating on that. So coming from that question, apart from observing other physical therapists like a student would while shadowing, should students also shadow occupational therapists and other specialties closely related to physical therapy because of the interconnectedness?
Yeah, more and more interprofessional education is becoming a big focus. And so students understanding what the other professions are doing. The expectations of job shadowing are hard to do on top of everything else you're trying to do to get through your education. And a lot of times people are having to work a little bit too. So the perfect scenario is to get a job in a rehab type setting, which happens, but that's, you know, maybe 1 in 10 or 1 in 20 students who end up getting an opportunity like that. If you're trying to decide between the two professions, absolutely, I'd spend a lot of time with both. But otherwise, I'd say, you know, while you were in your PT job shadowing, you could even ask and say, could I spend an hour or two also seeing what's happening with the occupational therapist, or seeing co-treatment sessions if they happen. There's certain settings like neurologic rehab and pediatrics where there's a lot of co-treatments that might happen too, where both a physical and occupational therapist will see the patient at the same time. So it can be nice, but if you're not considering between the two professions and you know for sure physical therapy is what you're going to do, then you want to get most of your hours focused towards that because there's already a breadth of what physical therapy does. So I think one of the big things a lot of people are familiar because of sports or because of orthopedic problems, and they've seen a physical therapist themselves. We joke that a good chunk of students are in our PT programs because of an ACL ligament injury or something like that. So getting some exposure to hospital care, to geriatrics, to pediatrics, and to wound care. Wound care is probably the biggest part of what physical therapy does that people don't really know about. And so you can work with people who have burns, who have open ulcers and things like that. And it's good to know that that's part of what you're going to have, because there's going to be course content on that. You're going to have to pass a licensure exam on that. And during your clinical training, you're likely going to see some of those patients too. And that's probably the biggest surprise for people about the profession.
Okay, so following the line along the overlapping professions, one of our audience members asks, what are the differences between the roles of PTs and physicians specializing in physical medicine and rehabilitation?
That's a great question. So, and our physical therapy program is within the Department of Physical Medicine and Rehab Medicine, which includes physiatrists, which is a doctor who specializes in physical medicine and rehabilitation. And so traditionally, a physician would write an order that was very prescriptive and say, send the person to physical therapy and say exactly what to do. Use this ultrasound or a hot pack or some of the old modalities is what they used to be called that we would work with. Profession has grown and changed a lot now. And so mostly if a physician sends a patient, they say, evaluate them and treat them. But what does the physiatrist do that the physical therapist doesn't do, and vice versa? Physiatrists are essentially responsible for the medical management of the patient. So they might be operating in a rehabilitation unit where patients post-stroke or post-COVID or these areas where they're going to be an inpatient and they're going to get intense rehabilitation. The physician would do rounds and see them in the morning and make sure that their medication is appropriate, make sure that there have been orders for all the different therapies and all that sort of care, but they're going to spend much less time with the patient is one of the things. And they're overseeing that broader management of the patient. The physical therapist, we don't order medications. We would only order limited imaging under very limited circumstances in those kind of scenarios, we're working directly with the patient and spending, often in a rehab unit, they have to have 3 hours of therapy a day. So that's between occupational therapy and physical therapy and speech therapy. And so a lot of that hands-on direct treatment time is something that the therapist is doing and the physician is not doing. Again, often the physician will be, but they're not going to be doing treatments. They're going to, again, order various medications, potentially order the therapies. And so nerve block or an injection, those things would typically be done by a physician and not by a physical therapist. And so it's that broader medical management, which has pros and cons. Certainly you're going to get paid more as a physical medicine physician, but you're also going to have completed 4 years of medical school plus, I think it's about 4 years of residency for physical medicine and rehab. Certainly acquired some debt. And also you're not going to get the same amount of time with your patients. That's one of the rewarding things about the physical therapy is the amount of time that we get to spend with our patients. And the downsides are less income and sometimes less understanding of our role and that we can diagnose these movement problems. So sometimes you're getting overly directive referrals. But that continues to change as the profession has grown into a doctorate profession and there's more appreciation and understanding of what we can provide for the patients at less cost. So.
Thank you for that. There was a question regarding your profession and just when you were obtaining your doctorate. Have you done any research within your degree or just right now as a professional?
Yeah, so my job involves quite a bit of research. So my typical day, I'm in administration now, so that takes too much time. But as a tenure track professor, basically, which was what I was before, half of my time was dedicated to research, and then about 40% of my time to teaching, and about 10% of my time to service committees and a little bit of clinical work and that sort of thing. And so, so that's a whole nother aspect of the profession that I find personally really fascinating. So now we're not just educating students on what is currently known, but we're actually trying to understand problems in ways that help all professions, not just physical therapy, but surgeons. I work really closely with a surgeon on the research and trying to figure out which patients with certain shoulder problems really need surgery right away versus which ones are going to benefit most from rehabilitation, and then also looking into preventive sorts of things. I work with engineers also that understand biomechanics and those sorts of things and are helping to design models that can help us understand how the human system works and how injuries occur. For instance, you can't put a sensor in a person that measures how much muscle force they're producing, and models can help us understand that. And other engineers are designing devices. So people who have to propel a wheelchair have a lot of shoulder pain. And so we're working with an engineer at the Veterans Administration who's designed a different wheelchair that changes the way they propel the wheelchair to try to reduce their shoulder pain. So there's really neat opportunities across, again, a real breadth of things. So research is a component of physical therapy as well. Sometimes for people in clinical settings, more often in academic settings.
Okay, so following another track of questions over here. This one is quite interesting, actually. So it asks, do you have any ideas of how practicing physical therapy might change in the future?
Yeah, that's a great question. I think it's never fully predictable, but I see the profession continuing to grow as long as we don't sort of shortcut what we're doing. So this is part of the reason why I'm not a big fan of those 2-year education programs, is because then they're just producing somebody who can do what we know right now and do it sort of as lowest cost as possible. as opposed to trying to really push what we can do to maximize the outcome and the function for individuals. And so physical therapists are growing in their ability to diagnose, again, not everything, and not the things that physicians typically diagnose, but to become true movement experts, to be able to evaluate somebody like you just saw and say, this is the fundamental problem. These are the muscles that are not working. This is what we need to do in terms of their rehabilitation. So that aspect, I believe, will grow. I think that the interprofessional nature will continue to grow too. So again, working with a variety of individuals. There's more private practices that are springing up that are incorporating technology more. So traditionally, our profession has been, again, your hands on the person a lot and your vision of what you're seeing with them. There's more and more tools that are coming out that are allowing us to automate some of these things, but in very positive ways where you're still interacting with them, but maybe you're using your mobile phone to place on the person's shoulder and actually measure the range of motion that they're doing with all the sensors that we've got in our phone now. That's one of the research projects that we've worked on. Or again, these new designs of new devices like different wheelchairs and things like that that can change how people function. There's more and more going on, just fascinating things with robotics and with implantation of devices. So at the university, people with spinal cord injury, they've learned that they can implant a device that was originally designed to reduce pain, and it'll actually stimulate the spinal cord. And they're seeing some recovery of function, even when the people have the device turned off. So it's really just fascinating things that where stem cell technologies are going, and regenerative medicine where they can, heal wounds in ways that they never could before, neuroplasticity of the nervous system. So just as healthcare in general advances, there's more and more need for that rehab to take advantage of all that technology and maximize how the person can actually function and recover. So just like you saw that person who had his surgery but still couldn't move his arms, we can replace parts more and more, and again, start to rebuild after spinal cord injury and fascinating things like that. But they really need the person that's there working with them to help actually accomplish all of those things. So I see more technology, more interprofessional practice, and more aspects of diagnosis where you're working with a team. So maybe you're the doctor of physical therapy and you're not doing as much of the actual treatment some point in the future. You're working with your team of physical therapist assistants, or athletic trainers are getting more involved too. And maybe they're doing some of those treatments as well.
Awesome, thank you. It's so interesting to see the new research just helping people.
Yeah.
So Aubrey has a question about your profession. What are some difficulties that you come in contact with, and how do you deal with them, specifically while working in the clinic with patients?
Yeah.
She's asking specifically about like communication barriers, like language barriers, or just when a patient refuses to cooperate, and also just motivating patients who don't want to do their exercises. And if they're in pain, like how do you handle that?
Yeah, those are great questions. So again, part of the rewarding part of this is that, again, most patients are going to get better, with a few exceptions. One of the hardest groups to work with is cancer patients, because sometimes, they're in pretty dire straits. They need some mobility to keep them going, but they're often depressed, and again, in pain and all these sorts of things. So, part of that is just, if you're in an inpatient setting and that's your population you're working with, you come back, you go see the patient. They're saying, no, I don't want to do it. You say, okay, I'm going to come back in such and such time, and then let's try it again. And here are all the reasons why this will really help you to feel better. And with regard to pain, that's the real key to a lot of what I do in outpatient orthopedics, is teaching them how to move differently so they can manage their own pain. And so then again, we're trying to reduce how much they need medications, particularly things like opioids and things like that. And so you're going through this process with them as you're evaluating them to figure out what movements they can do, what can allow them to still function the way they want to, but reduce their pain. And again, then the patient is completely motivated because they ultimately realize that whatever you just did, if you can help them understand how they do that, that's what's really going to get them better. And that's one of the other things that's changed about the profession. When I first started, you'd get a prescription from a physician and it said, you're going to see this patient 2 to 3 times a week for 6 weeks, and you're going to do these very specific treatments with them. And again, now it's pretty much they come to see you. They can come to see you without even having gone to a physician first. And ultimately, I see most of my patients where I see them every few weeks, and they're doing most of what they need to do at home. And so again, it's a lot about educating and teaching them how to do things. And as soon as they start seeing that progress, they are all in. So right now I have a patient who's about 14 years old. She's a swimmer, and she has instability of her sternoclavicular joint, which connects basically your collarbone to your trunk. And that's not it's very uncommon issue. And it's not an easy one to work with because there's not a lot of muscles that cover that area that we can just strengthen the muscles. And so there was a lot of movement retraining with her, and she's now back in the pool part-time. We changed the stroke that she's using. And again, the initial thing when she came in is, well, this is unstable. I probably have to get surgery. That's a scary surgery. And I really just want to finish out my high school career. I'm not trying to be a Olympic athlete. I just want to be able to participate on the swim team. And right now it's looking really promising. And I told her about my most compliant patient because she does everything I tell her because she can immediately see the impact of it and how it directly relates to her getting back to her goals. So you tie everything back to their goals. And again, you have to, as the one individual talked about, be really creative in thinking about how you're going to help them do that. And can you start them off towards their goals? A lot of times we have to tell people you shouldn't be doing that right now because you're doing more harm than good. But now if I'm telling them, yeah, that insanity exercise program you're in is probably not your best bet right now, but can I find ways that you can participate in an exercise program that are somewhere in between where that is taking you, that are bad for you, and that are challenging you just to the right level to not continue to injure things, but to allow you to recover and eventually get back to the things you want to do.
Thank you so much, Doctor. I love listening to how different healthcare professionals can help their patients in many different ways. It's fascinating, honestly.
Yeah.
Okay, so Anthony asks, what would you recommend for a student interested in PT to do after undergrad? Acquiring experience from job shadowing and internships, or immediately applying to graduate school? I'm currently a junior and I have no clue what to do after I'm done with undergrad.
Yeah. Oh, if you're seriously interested, definitely try to get some job shadowing, but I would encourage you to apply. You may not get in right away, depending. It is competitive, and you can always certainly continue to work in between, or you don't have to accept the admission if you would get in and you're just not sure that that's what you want to commit to at that point. But getting in that mix and finding out what you need to do from that admissions process to be successful is really helpful. Otherwise, look for job opportunities. There are job opportunities as rehab aides and things like that can allow you to get a great experience in employment. You get to interact now directly with the therapists and really learn from them what they like or maybe don't like about their jobs, and depending on the circumstances. If you can't find a direct rehab type opportunity, a job in skilled nursing or any sort of patient care kind of things can be really helpful just to have better understanding of healthcare in general, and allow you to earn some money as you sort out exactly what you want to do from there.
Awesome. So another question we have here is, do you consider your profession as more diverse and inclusive of minorities than other medical professions? And just how do you deal with being more inclusive?
Yeah. So that is one of our weaknesses as a profession. We are less diverse, and I think I'm in Minneapolis, so the circumstances that just happened with George Floyd were really a big awakening for a lot of people. We've always said, well, we want a more diverse profession, but finding ways to be really assertive and aggressive in making that happen hadn't necessarily been happening. And so we're really working hard to improve our diversity. We've actually hired someone at Minnesota to lead some of those efforts, who's a person of color and a physical therapist. And so it's definitely, I think well, it's always been a stated priority. It's not necessarily always been a priority in action. And I think that is changing dramatically. And we need diverse representation because obviously the populations that we serve are very diverse. And so that's a big emphasis for us right now, and trying to help with the financial barriers too. At Minnesota, we've been trying to hold our tuition. We haven't raised our tuition for 3 years now, and we're hoping to continue to do that. And we're trying to increase scholarships. We have some very supportive alumni who are helping us add to our scholarships as well. So compared to medicine, we are a little bit behind where medicine is. I think most of the rehab professions, occupational, physical, and speech, are pretty similar in their lesser diversity than we should have. So.
Yeah, I definitely agree that we should, try to be as diverse as possible and as inclusive as possible, taking into account how much our world is changing. And yeah, definitely acknowledge how important other people are in the different professions. So another question our audience asks is, do you think more people in your profession are angling more towards opening their own clinics or practices, or even working in hospitals?
Yeah, so I think there's some of both. I would say it's still more people probably that come through that want kind of the traditional, where they don't want to be their own boss and figure all those aspects of things out. That's definitely the majority of students, but there's also more and more creative things. So like one of our recent graduates works in the hospital, works 30 hours a week there, but then basically on the side has opened their own clinic specifically for runners. So they couldn't afford to do all this right away, right out of school. So they took the traditional job, but then they're also following their dream of having this own clinic and letting that build over time to where they can switch over and do that exclusively. Another person who graduated a couple years ago, I was just in touch with, and she is starting her practice where, in addition to, again, another regular clinic job, she is doing some home visits where she actually is going to people's homes to provide therapy, which has always existed for home health care when you qualify and you can't leave your house. But she's actually doing it for those that don't necessarily qualify for home health, but just want somebody to come into their home and provide the care. Particularly in pediatrics, that's really popular for people to be able to have someone in and work with their child in their home, as opposed to having to take them into a clinical setting. So there is a lot of opportunity for that. And one of the nice things about the profession too, and I think medicine is changing this way a little bit more too, physician roles, but you can be a part-time physical therapist. It used to be hard to do that as a physician, but again, now I think that's changed. But so you could take a 3/4 time job, get the benefits, all those sorts of things, and still explore these other more creative opportunities that are otherwise sometimes a little scary to venture out on your own and make sure you can figure out all those business nuances on your own. So.
Awesome, thank you. So another question that we had is just, how do you keep learning as a physical therapist, just refreshing your memory about just previous scientific knowledge, but also just how to just keep in touch with the new knowledge? Do you listen to a certain podcast, books, or do you read certain medical journals?
Yeah, great question also. So we definitely want to encourage our students to be lifelong learners. And another tidbit about me, I guess, one of the other things I said was going into academics was a way to become a perpetual student. I always liked being a student and learning, but now you get paid for it. So academics inherently, you're constantly continuing to learn. You learn from your students too, and that's just really refreshing as students ask good questions and those sorts of things. In a traditional clinical environment, again, another thing is, even though you're learning how to diagnose and categorize people and stuff, every individual is still different. And so again, in those cases, you learn from your patients. And so when somebody comes in with something that's a little bit different than what you've seen before, you go back and you look at textbooks, or nowadays you can find a million things online, and you sort out journal articles. They're within physical therapy. The Professional Association has a journal called Physical Therapy. And then there's within subspecialties, there's the Journal of Orthopedic and Sports Physical Therapy. So those are the two main ones I would potentially look at. But then there's other journals for physical rehabilitation overall, orthopedics specific. So there's a lot of journal articles, and nowadays it's a lot easier to get that information online and access journals and things. So so you continue to learn from your patients, you continue to learn from journal articles. You're required to do some continuing education every year to maintain your license. So there are courses you can go take. And then there's also a lot of places where they have what's called journal clubs, where a lot of therapists in a clinic will get together and read an article once a month together and talk through it. So lots of opportunities.
That's wonderful. Okay, so the last question we have over here is, and this was a little bit personal. Did you ever face doubts or not have support from your family or friends while on your path to becoming a physical therapist?
Yeah, so I am a first generation college student, which I'm sure many people are. And again, we're trying to be encouraging and supportive of students in that regard. And at Minnesota, for instance, well, we don't necessarily have as much racial and ethnic diversity as we'd like overall for socioeconomic status, first generation students. The broad definitions of diversity, about half of our classes are fitting into those categories. So for me personally, my mom had been a nurse, so she had some advanced training, but my dad was the only person in his family to even complete high school. He grew up on a farm, and it was kind of like, okay, you guys got to help with the farm work and then get a job. And so education was not a big deal for him. Now, again, when I went to school, it was a bachelor's degree. So I didn't have help from my parents. My parents didn't have the finances to do it. Again, it wasn't as something that was as big a priority for them. There wasn't any real resistance to it, but I had to figure out the financial aid and all those sorts of things myself. But then when I went back to school to get my master's and my PhD, actually my dad wrote me a letter with no punctuation, deliberately, because he wanted to emphasize that you can have too much schooling, or, so it was interesting because he was a very supportive guy, but this was just like, that just seems like way too much time in school. And you're going to become too elitist or separate or something like that. And so that was the extent of it. He later actually helped me. I got sick just before I had to defend my dissertation, and he was helping me put together my final document and things. So it was a temporary thing, but sometimes parents don't understand or family don't understand, and it's a lot of school, and why are you going to all this school? Why don't you just get a job? And those kind of things can come out sometimes. And I just say, if this is something you want to do and something you love, just persist. And again, I'd go back to those job satisfaction numbers. There's very few people who say, you know, I really wish I wouldn't have done this. They really enjoy the job, and that's another thing you can put back on them about if they're just worried about you're getting employed within physical therapy. Again, the job market is such that it's very secure that way. There's not a lot of risk in going to school and then not having any opportunities when you get done. So.
Awesome. I'm so glad that you like your job. And as someone who comes from a family of immigrants, I can totally relate to that thing with your dad. So just that was our last question. So thank you so much for that awesome presentation and your great responses to our questions. We really liked it. So I'm just going to go ahead and share my screen so we can get started with our wrap up. Awesome. So considering this, we would like to encourage everyone to reflect on the session today. What brought you to the session today? What are 3 major takeaways you got? And what do you want to learn more about? Writing this reflection isn't required. However, we do encourage you to submit it to our website for publication and recognition of your hard work and to enhance future applications. So you can submit your reflections into our website and with pre-health shadowing /blog submissions, and go ahead and I will review it as I'm the editor-in-chief. You can also submit articles and reflections, reviews, and success stories as well that aren't related to shadowing. If you want to learn more about pre-health shadowing and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. We are also accepting team member applications if you want to take on a more active role in PHS and lead projects and initiatives. Once again, we are humbly asking that if you are financially able to donate, that you please consider sending a few dollars to us via Venmo or PayPal. It does cost a lot for us to keep our Zoom running and our website running and all of the things in our program free to everyone and accessible to everyone. So please support those who cannot donate by donating to our organization so everyone can get the education and opportunities they deserve during the pandemic where we can't go in person. Otherwise, we simply ask you to spread the word about pre-health shadowing so all students from across professions or interests can come in and join in our sessions because this is a valuable learning experience for everyone. So do share about our platform on your social media so other students can know what we're about. So now for the part we've all been waiting for, earning a digital certificate for the virtual shadowing hours from this session. So first you are going to go onto our website and find our professionals courses page at prehealthshadowing.com. Next, you can take our quick 10-question multiple choice quiz based on the content from this session today. You will have 30 minutes per attempt to earn a 70% or higher to get your certificate. And we do know that technology can be difficult, so we allow 2 attempts per session. But if you do run into any difficulties, please contact us at info@prehealthshadowing.com. And to ensure that our website doesn't crash from the high influx of students going on to take the assessment, we recommend waiting 30 minutes to an hour after the session to take the quiz. The quiz will be up indefinitely, so you can take it next month if you'd like. And if you want to refresh your memory about the session, we do have it recorded on our YouTube channel. So once you've passed the assessment, you can click the Finish Course button at the bottom of the page and you can download your certificate, verifying your virtual shadowing hours. Your account on Pre-Health Shadowing will keep track of your hours for you, but you can download it for your own records. If you missed a part of our session today or just want to go back and view the numerous sessions we have from so many specialties, you can earn more certificates and virtual shadowing hours by going onto our YouTube channel and watching our previous recordings. You can also find them via the professional pages on our website, taking the post-shadowing assessments on any of them if you'd like. Be sure to follow us on social media and subscribe to our email list for the latest updates on our upcoming sessions and any events we have. We are currently booked every weekday through June, So be sure to keep an eye out on your favorite professions and specialties and just logging on to our Zoom sessions. I hope to see you guys in our future sessions. Thank you so much for joining us today. Please stick around if you have any questions for myself and my other team members, and we will be happy to answer them. This shadowing session is officially over, and I invite everyone to log off. Thank you so much, Dr. Ludewig, for your time and effort.